At the Worcester Street Surgery in Stourbridge, Dennis Mannix has arrived for a review of his chronic obstructive pulmonary disease.
Take a big breath in, pop it in your mouth. Keep going, keep going.
This is part of a new approach by Dudley Primary Care Trust to review all patients with COPD at their local GP practice to try and reduce the number of hospital admissions associated with this long-term condition.
In Dudley we've got 4,850 diagnosed patients with COPD, and although compared to diabetes that's a lot smaller number, it's the amount of patients going into hospital because of exacerbations was quite high. And we are aware that a lot of these were avoidable admissions. And had they had a self-management plan, their antibiotics and steroids, and been more aware of their condition, these admissions would have been avoided.
These new annual review sessions are designed to both assess the patient as well as to educate them about what they can do to help manage their condition.
All patients will be given a personal management plan, and this will talk them through the basics of their condition, and primarily the key thing of this is what to do when they have a flare-up. And then these patients are given standby antibiotics and steroids. And what they're told to do is when they become unwell, when they get symptoms, they start their antibiotics and steroids. They then contact their GP surgery to let them know they've started their medication. And this will prompt within the surgery some kind of action. It may be the patient needs a visit, it may be they can come to surgery, or it may be they'll just get followed up in a few days. So all of these patients should always have a standby prescription of antibiotics. And we know that in itself will reduce hospital admissions because there's no delay in a patient getting their medication to treat their flare-up.
GPs are working in this way right across Dudley, and they're successfully managing these patients in primary care, freeing up resources in hospitals.
Certainly primary care is underutilised at the moment, and I think bringing in schemes such as the COPD service, I think it's just the start of things. I can see it happening across the board with various other chronic conditions. So I think there will be a lot more emphasis on trying to keep more services out in primary care to take the pressure off secondary care.
The response from patients has been absolutely fantastic, and I think primarily because all of a sudden there's people who are offering them something that wasn't there before, and the feedback was overwhelming and very positive from patients.
It's great to be able to come here to the surgery to see Joe.
It is easier to come here actually because I've got to get 2 buses to get to the hospital.
I feel more confident to manage my condition at home, and I've got antibiotics and steroids at hand when I need them. For me it's great, yes.